Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Have an amazing young lady here today, Jessica, who, according to her mom and her life has really been changed by coming here. Now, even before you came here, you were actually on ketamine, right?
Yes.
So why don't you explain your journey of why you ended up going on ketamine and then why you ended up coming to Caring Medical. And you have a couple unusual symptoms like the sweating and the heat intolerance and things. And people often wouldn't realize that those things can come from a neck problem.
So basically the ketamine started because we tried everything. We basically tried opioids, NSAIDs, which destroyed my stomach to the point where I had to go see a gastroenterologist to get it back together. Physical therapy we tried before they did something weird with my neck. It was weird. We went to doctors that didn't know what EDS was and said basically I was faking or it was mental, and I was checked out by a therapist and psychiatrist, and they said it wasn't.
Okay.
So we found a ketamine clinic. The first ketamine clinic did not use Versed. Versed is when they're able to, it's a drug that's able to counteract the high, so you only get high a little bit. But I used it without Versed because I was a part of I think of a clinical trial, I'm not sure.
Okay.
But I did 5 initial ketamine infusions every single day. And then after the 5, I went back every 6 weeks. And I had pain all over my body. I couldn't walk. I was homebound. I could not get out of my bed.
And you were trying to still do school because you're a psychology major.
Yes, I was in high school at the time.
Okay.
I went to a performing arts high school before everything happened. So I was still trying to do school, but I had to stop doing in-person school because of the symptoms.
Did you come here because many of the symptoms actually the ketamine wasn't touching? And then what were those symptoms that were so severe that you thought you should come here?
So the first symptom was the neck. We tried, everything was better except for the neck, and the doctors were thinking something isn't right. And then I also started to develop trigeminal neuralgia on both sides of my face.
Like horrible.
It was
like
bad. I couldn't touch my face. And the sweating, they thought it was POTS because they usually just, you have POTS. That's what's going to happen if you have POTS.
Yeah.
But it just didn't fit with the diagnosis.
Explain the sweating, how bad it was.
It was where I was drenched to the point where I had to have fans. I had to walk around with a fan. And I still get hot, but it was just horrible. I would have to change my clothes
it's almost like an
day.
Internal heat.
Yes.
Almost like you have a fire in you.
Yes.
And it's like burning in you.
Yes.
And there's nothing you could do taking ice. There's nothing that gets rid of it.
Nope.
Okay, so you had that. And then what other symptoms did you have? Like your digestion?
Oh, my digestive was horrible. It's better now, obviously. I'm alive. But it was just horrible. I couldn't eat. They thought it was functional dyspepsia. But, it wasn't, adding up, and I was taking the medicine, and it didn't fully... I think it was the motility of my digestive system that was kind of down, and it was just not... It was not being helped by the ketamine. It wasn't being helped by anything.
Did you have POTS?
I have POTS, yes.
Okay, mast cell, do you have that with the hives?
I went to the guy that referred me. I just went back to him. He's 99% sure I have it because I get tomato face. So
yeah, exactly. You get.
I have pictures of myself just tomato.
Because it was getting really hard to continue school, right?
Yes.
So tell us about that, because the focusing and the vision. And...
it was hard to read. I couldn't read without my face because I had some nerve pain up here too. It was hard to read. I couldn't open a book and read. So, or I couldn't be on a phone. A phone was easy, but laptops I couldn't be on. And I had to do laptop schooling, so that was really hard.
Okay. And then, so do you found the YouTube videos, or how did you find Caring Medical, or did the doctor refer you?
Etzel Bittencourt diagnosed. referred me to you.
Because you had cervical instability.
Yes, he noticed I had cervical instability by like checking my neck, and he was like, "Yeah, he sees EDS patients a lot, so I was able to get your information and come here."
And then how many visits have you had?
From Edsel Bittencourt.
Oh, here.
Oh, so I think this is my 7th.
Okay. And then how are you doing?
Extremely better, 90% better, 95%. It's trigeminal neuralgia. I still take like carbamazepine. I tried weaning off it. It's. I think it's just going to be at a baseline, but I can touch my face. I don't. It doesn't even bother me. I don't have pain.
And then how's the sweating?
It's Florida, so there's going to be obviously like natural sweating, especially up in Jacksonville where I live, but I don't have problems.
Okay. The fire inside, like it's kind of like you have normal sweating now versus like that fire sensation went away.
Yes.
And then how's your digestion and the other symptoms?
I don't have any problems. The first prolotherapy, I started feeling the digestive system getting better. I haven't had problems since.
And then your brain, is it functioning again? Because, when I saw you today, I could tell right away you just seemed like more your normal self, like happy, smiling, because you weren't smiling too much when I first saw you.
It was painful. It was extremely painful. My brain is a lot better. I'm focusing a lot more. I'm able to study without not, like anatomy, I'm taking anatomy. Anatomy is really hard to study, so I'm actually able to focus and study. I've been getting all A's in school, so... while double majoring. And
what are your majors?
Sociology and psychology.
And then what do you want to do?
I want to be a pain psychologist. I want to help people with chronic pain get over it's hard mentally being in chronic pain. So it's really beneficial if you have someone that understands and knows it, who also has a psychology background to help you.
I had asked you earlier before we started this interview, I said, when was your first symptom? So when was your first symptom?
Age 7, neck pain.
Okay, neck pain.
I've had neck pain all my life.
When did the neurologic symptoms start? Like the digestion,
Probably age 7 too.
Okay.
I had a really bad.
So you've probably seen 100 physicians or 100 different people.
I've seen everywhere. Pain doctors. I know 100 pain doctors looked at my case and they all rejected me. So that was fun.
So what would you say to somebody who, nobody likes shots, right? Because I'm confident there's people that don't come here just because they have a fear of shots.
Yeah.
So what would you say to them? I mean, you don't like the shots either, but they've had a dramatic effect on you.
They're there for a second. They're a little wonky. It's kind of scary first time. It's scary every time, but it's there for a second. It's like 2 minutes and then you're done. Okay. And then you deal with the stuff afterwards. And then the first one was kind of more scary, but now after you get used to it, it's a lot better. And honestly, shots are going to be shots, but they can change your life.
One thing we didn't talk too much about was your neck pain. So is that a lot better? And I think you had back pain and other body parts too.
I don't notice my neck pain anymore. It's to a base, like EDS is going to have pain. But it's to the point where I don't notice it. It was bad. I couldn't lift up my neck. I couldn't hold up my neck without feeling pain. I used to keep my neck like this because I didn't have a curve. My curve is back. It was just really hard to even sit up at school and do work. Now I'm able to sit up. I have 3 continuous classes every day, and I'm able to sit up and do my work. So it has changed my life.
How bad was it as far as like the psychology of it before I saw you? Was it getting bad? Like even you as a psychology major, was it getting where you were getting kind of pretty depressed and anxious and stuff?
Luckily, I do have a pain therapist myself. That's how I found out about pain psychology. But even then, I was just not happy. I was depressed. I was anxious.
Because you knew something was wrong, but the doctors weren't finding it.
Yes, I was pretty sure I had CCI just because I did do research, and I did see your website, and I did do research before. My neck was like, half of my neck was going one way and the other half wasn't. And I looked at a doctor and he's like, your neck is fine. And I went, that x-ray doesn't look okay. And I'm not a doctor or anything, but usually a spine looks like this and it's straight and it's nice. No.
Right.
So it was really hard before.
Yeah, I think too, like you said, when you have something like you have chronic pain or chronic disability, and then you're then a healer in that, it's much more powerful. Like most of the symptoms my patients have had, I've had it because I was in a really bad car accident when I was 14. I don't have EDS, but I ended up with quite a bit of cervical instability that I've had to get treated over the years, and I feel like I'm more authoritative in my recommendations because I can say definitively that eustachian tube dysfunction, it can get resolved, drop attacks can get resolved because I've had these things. So I'm excited for you because you probably are going to learn the most probably for your career by you having the condition. Like you just have so much insight into it.
Especially going through it at a young age.
Yeah.
Because some people some people don't even know how EDS. My mom didn't know until like she was like 60.
Yeah.
So it's just really good knowing at a young age so I can help people who are a lot more people are starting to notice EDS.
That's good.
And a lot of people are getting diagnosed younger. So it's good to have a foundation of, yes, I went through it, so I can help people who are going through it at a future date.
Okay. No, that sounds great, and we appreciate you sharing your story. Here, you had said to me earlier that, your daughter's just totally different. So I just want to get a mom's perspective, because you had to watch her over about 20 years, like she's obviously an amazing person, like just her personality is like infectious.
Yes.
But man, to watch her suffer for 20 years, it must have drove you nuts, like going to different doctors and nobody's like helping her.
It actually really did, Dr. Hauser. My husband and I were just completely fed up with the traditional medical profession. No one could help us. But when we did find the people that help, it was the non-traditional medicines that seemed to be helping. And to watch my daughter go from being in hospitalization homebound school for her last 2 years of high school in a wheelchair, we were devastated, and then COVID hit. First it was COVID, and then that happened. But yeah, to watch her grow and get better, finding you and the ketamine and at Bittencourt in Jacksonville, it's been a life changer for her. To see her now to be able to be a college student out there, being more independent, her life has changed. It really has.
Yeah, and then when you have somebody that you love that's so disabled and you're trying to figure out what to do, did you guys pray a lot? Because a lot of people, it almost seems like they find us here, because they pray and they're led. Did you feel that way, or how did you guys end up finding the office here?
Well, we did do a lot of praying, don't get me wrong.
Yeah.
But to be honest with you, we found you through seeking things outside of the traditional doctor realm. We had
you typed on Google weird doctors.
No, we didn't do that. We were going to try acupuncture.
Okay.
And two doctors in Jacksonville that used to be with Mayo Clinic, they had decided to leave and open up their own so that they could do more in their practice. And one is a neurosurgeon, and the other is a PT doctor who specializes in EDS. He has EDS. His children have EDS.
Okay.
So he's passionate about that. So that's how we found you.
Yeah, and then one of the things that he utilizes or recommends is prolotherapy.
Absolutely.
Well, there's a lesson in that nobody can have all the skills. Like, I'm not a physical therapist, so I'm not an expert in physical therapy for EDS. So for somebody who wants a specialist to help them with an exercise program and how to live day to day with EDS.
Absolutely. And I think also having the pain psychologist has been, having the medical side and having the physical therapy side and having the pain
emotional side.
It's a holistic thing. You have to for
even to heal like from prolotherapy, the better emotionally you are, the healthier you are, the better you're eating, having a strong faith, all that stuff helps you heal.
Absolutely.
Just wanted to get Mom's perspective. So you've got to be like ecstatic, like
Oh
you got
my
your
gosh.
daughter back.
Absolutely, yes. And thank you for helping us and being diligent, being there for Jessica, because she was very skeptical, you know.
No, but that's kind of good.
Yeah.
No, you bring up another thing. It's interesting because over the years I've had patients skeptical, husbands skeptical,
Right,
their
right,
wives
right,
get
right,
the
right.
thing, and it's just prolotherapy just works. So
It does.
I mean, I'd prefer that somebody believes in it when they first get here,
Right.
But it actually doesn't matter because instability is instability, and when you're not unstable, then you just
Yeah.
feel like way better.
Absolutely. No, you've changed her life.
Okay. Thank
You have
you.
absolutely
It's been
changed
great
her life.
having you guys as clients. Yeah, sounds like this might be the last visit, so I'll be sad.
Maybe. We will be too.